So I've been a physical therapist for 30 years. Outpatient orthopedics. I work at SLU Hospital, still PRN. About 10 years ago, I started doing pelvic floor physical therapy. Why? Well, because even way back when I was out of school, I really was attracted to the patients, the pregnant patients, the moms who had just had babies, even before I had my babies. And so I got an interest then. And then fast forward to when I had my son. And then when he was 2, then I had triplets. So that kind of opened up the doors and opened up my eyes to the need for pelvic floor physical therapy. So I would be around a lot of women, multiple ladies who've had multiple babies. We'd all be sitting around, haha, don't make me laugh, I'll pee in my pants, me too. And everybody thought it was funny. And I would be the one that'd be like, you guys, you don't have to do that. And everybody, whatever, no, I'm fine. And I'll just wear a pad and everybody's, and so that really bothered me. And then on the flip side, a lot of my coworkers wanted nothing to do with it. Like, oh gosh, pelvic floor, no, you take them. So it was my calling. I'm like, all right, I'll do it. So I was trained, and I mean, it's lovely. Every one of us, men and women, could use this talk and change the way we're sitting on the toilet and what we're doing so that we keep our pelvic floor, just like every other muscle in our body, as strong and flexible as it can be so that we don't have issues down the road. So that's why I started doing this. So take the quiz. You guys have it in front of you. If you guys do not, I will read the questions. So first question, do you have a sudden need to rush to the toilet to urinate? Oh my gosh, I gotta go pee. Do you urinate more often than every 3 to 4 hours during the day? Do you get up more than one time during the night to urinate? Bowel movements, are they irregular? Do you ever have to push or strain to have a bowel movement? And do you have any kind of pain in your pelvic region? So those 6 questions, if you answered yes to any of those, and they are truly yes, no questions. If you answered yes, you could have some pelvic floor dysfunction. Not a big and bad thing. That just means that you have some things that maybe we need to address so that they don't become some major problems. We're going to get into where the pelvic floor and everything is, but the one other big take-home thing, and I kind of mentioned this, is all of these things are common, not normal. And unfortunately, a lot of people think it's normal as women age that they're going to have these issues. After we have babies, that we're going to have these issues. Big misconception that if you have a vaginal delivery, oh, then you might have some of these issues. But if you have a C-section, you won't. I can tell you, C-sections, lots of scar tissue, you still are going to have possibly some issues. So all of these things are common, not normal. And I'm not saying that you're not normal if you have these things. Just be thinking you don't have to live with this stuff, okay? Other countries, when a woman gets pregnant, she goes to pelvic floor physical therapy. One visit, if she needs to, she'll go more. But she has the one visit, prevention, education. And then at her 6-week postpartum visit, she goes to pelvic floor physical therapy. So it's normal care that they go during pregnancy and then postpartum. So that would be awesome, because then at least it would catch all of the women who have babies. And then when they're out with their other friends who, oh my gosh, I'm going to pee in my pants, they would say, hey, you need to go see a pelvic floor physical therapist, because all of them would have gone. So that's my dream, that someday that will be the norm of the standard of healthcare.
It should be.
It should, yeah. It should actually be. Okay, so what is the pelvic floor? The pelvic floor, this is my pelvis that I carry around with me. The pelvic floor is 3 layers of muscles. So here's my pelvis. Can you guys see me? There we go. There we go. Okay, so here's my pelvis. 3 layers of muscles that connect from the pubic bone to the tailbone. Okay, pubic bone to the tailbone. right here. What I want to bring up right now is just look, our pelvis located down in this area, how small this cavity is here. Okay, so you've got these 3 layers of little bitty muscles compared to your big old hamstrings, quads, glutes, abdominal muscles, back muscles that all attach to the pelvis too. So right there, these little bitty muscles that are stacked on top of each other have just the anatomy going against them, where they're located. Then let's think about gravity. So when we're in an upright position, these muscles have gravity pulling on them constantly. So again, puts them at a little bit of a disadvantage. Okay, one of the main jobs of these muscles is to control the openings to your urethra, so you can urinate, your vagina, and your anus, so you can have a bowel movement. Super, super big job. So these muscles are very important. Can't see them, so we don't really know what they're doing. They also are literally the floor of your core. Okay, so if you think of your core kind of from your diaphragm, your breathing muscle, to your pelvic floor, abdominals are in the front, back muscles in the back. The floor muscles are really, really important in your breathing, and we're going to talk about that in just a minute. They also have a very important role with sexual health, and they help you achieve orgasm. They're very important in that respect. Stability, along with the diaphragm and the core, that's very important. I think about your pelvis. As an orthopedic physical therapist too, that's really important. Your pelvic, and you know, I'm a pelvic floor therapist too. So all of my patients, I look at their core, their hips, their back. As soon as you have an imbalance, your stability is off. Okay, so that's really important. And then sump pumps. So they, with their contraction and relaxation, they help keep a lot of blood flow moving and fluid moving in that area. Okay, so they have some pretty important jobs. We don't see them, so we don't pay attention to them. All right, let's talk about how the pelvic floor is part of the core. So I already mentioned you've got your diaphragm, your breathing muscle, and your pelvic floor muscles. Okay, I think it makes so much more sense if you think of the pelvic floor as a trampoline. Okay, so there it is, connecting from your pubic bone to your tailbone. Okay, so think trampoline. So as you breathe in and out, that pelvic floor needs to contract and relax as you're breathing in and out. Okay, so that trampoline. So if you're a trampoline, you have to have mobility and flexibility. Okay, you cannot contract your diaphragm and your pelvic floor at the same time. So they work together. One of the most important things you can do, and I'm going to repeat this over and over and over tonight, is breathe. Okay, and it sounds silly. Okay, breathe. But think about what we do. We're always in a hurry. Got to get to that. We're stressed. We're tense. We don't breathe. Okay, so holding your breath is going to have a very much effect on your pelvic floor. And again, let's think of all those other things, and we're going to talk more what the pelvic floor has to do. So if you're not doing your deep breathing, you're not putting your pelvic floor muscles at an advantage. Okay, so that's really important. The other thing that people struggle with when I see them for therapy is they have to think about breathing. Eventually, you won't have to. That's like we're retraining everything. So initially, yes, to think about taking your deep breaths and diaphragmatic breathing, that's really important, but you'll retrain your body to do what it needs to do. Okay, so it's a very important part of the core. So prolapse. Prolapse is literally one of your pelvic organs falling out. Okay. Dr. Lynn, you may have seen, I have still never seen an actual bladder outside the body, but I have coworkers who have.
Oh yeah, I've seen it many times.
Okay,
Yeah.
okay.
The bladder outside the body, the whole uterus can be outside the body. And even if you've had a hysterectomy, the whole vagina can invert like a sock and come out the bottom. Yeah.
So I haven't seen that in my practice yet, but I have had other coworkers, physical therapists, that the patients come in and get up on the table, and that's what's going on. So typically when I see them for a therapy, it's just a little bit, and it's usually gets worse at certain times of the day or with lifting or whatever. A lot of times my patients describe it as just a deep pressure and really feeling like they need to push something up back in. And I just had a patient last week. So she felt this. So she got her mirror and she looked, and she had never looked before. And I'm like, we all need to look and know what it looks like down there. Just for now, if you're not having any issues, if you are having any issues. So she saw a little bit of a bulge, went to her physician. I'm seeing her right now. But yes, any of those organs, your bladder, your uterus, the vagina, rectum, that's a big one. Yeah. So they can fall. So therapy can help that quite a bit. Again, it seems crazy, but the breathing is going to help that. If you're holding your breath all of the time, you're putting more pressure on these organs. So that is kind of where it comes to be really important with the breathing and the prolapse. The other thing I'm going to mention right now, because we just talked about the rectum, but another thing that leads to the prolapse is constipation. So if you're backed up with stool, that's just a little bit of extra weight. Again, think about these little bitty muscles, this little bitty area. So if you've got this stool backed up, that's extra pressure right there. Then what do you do when you're constipated? You will typically sit on the toilet and you'll push and strain as hard as you can. And then again, what are you doing? You're putting this pressure on these muscles that can't do what you're asking them to do. So then things start falling. And as we age, our body isn't as stable and strong as it used to be. All of our ligaments, all of our connective tissue. So that extra pressure will actually be one of the risk factors for a prolapse. Of course, pushing during delivery, just being pregnant and carrying the baby, that extra weight, that's another thing that can cause prolapse. So prolapse can be treated. Not most of my patients, all of my patients have all gotten better. 100% of my patients have gotten better. Therapy works. So most of my patients don't. So you can use, there's a pessary you can use to hold everything in. My patients that I've had typically aren't very comfortable with it, but I know, and then some
pessary.
Yeah. So some patients will wear it just when they work out or for certain things and then take it out. But our goal would be to not have to wear it if you can control everything on your own. So, okay. All right. So let's talk about incontinence. That is probably when people do know about the pelvic floor, that's probably the main thing they think of is, peeing in their pants. So there are two main kinds of incontinence, urinary incontinence. One is stress urinary incontinence. That's with the coughing, sneezing, laughing, jumping jacks on the trampoline. That's with stress. Okay, that's when you leak. One of the most interesting things to do with my patients is if they know, oh yeah, it's when I cough or sneeze or laugh, and then they know it. Well, we'll do some investigating, and they might be leaking when they're doing other things, picking things up from the floor, walking up and down a flight of steps. I had a male patient who his stress incontinence was in and out of his car. Okay, and we figured that out, and then he did some different things in and out of the car, and he went from 5 depends per day down to 1. And he only did that because that was his job, traveling around. So he needed that one. So we can figure out, and sometimes when you're leaking and sometimes you don't. So then we have to come up with some strategies for that. The other kind of incontinence is urge incontinence. That's, oh my gosh, I have to pee, and you leak on the way to the bathroom. And look what I just did. And I'm sure you've all seen people, you've seen the commercials where you got to go to the bathroom. So what do? Squeeze your legs together, cross your legs, bend over, run. 100% you're not going to be able to hold it when you're doing all of those things. So a big part of therapy is to teach you the techniques and the things that you need to do to control it. So though, and you can have mixed urinary incontinence where you have a little bit of both. And sometimes people say they don't know. I have no idea. Just I'll go to the bathroom and my underwear is wet. So I don't want to say it's fun, but it is really interesting to figure this stuff out, and then, you know, and then we get rid of it. So it's awesome. All right. So we talked about some of the main, let me throw in here too, and I don't have that listed on my outline, but pain is another one. Okay. So when we're talking pain, anywhere in this whole region from the diaphragm down could actually be coming from the pelvic floor. Just a couple months ago, I had a patient with low back pain. She was treated orthopedic, physical therapy, all kinds of things for her low back pain. She saw some of my stuff and was like, I have some of those issues. So she got an order for physical therapy for pelvic floor. She doesn't have back pain anymore. So, and one of her big things, which blows my mind, Dr. Lynn can attest to this one. Her oldest son is like 25, her entire married life, pain with intercourse. And she just thought that's how she had to live. And I asked right away, did you say anything to your physician? And she's like, well, yeah, he said, you know, whatever. And he said, so a common thing that people say that their physician will tell them, oh, that's normal, have a glass of wine, you just need to relax. And that drives me crazy.
And drives me crazy too. So we take care of sexual problems here too, painful sex, low libido, things like that. So we never recommend a glass of wine when sex hurts. So that drives me crazy too.
So yes, it can be very specific. It can be pain with urination. It can be pain with intercourse. It can be pain with bowel movements. It can actually be pain in the groin. Sometimes the hip. So your hip rotators sit right next door to your pelvic floor muscles. So that is a big referral back and forth. Like I said, low back, abdominals. Sometimes, and again, some of these abdominal scars with surgeries, that can cause a lot of tightness and pain. And somebody is coming in with this just random kind of abdominal pain, and it ends up being the fascial connections to the pelvic floor. So pain. And a lot of times too, and I try to get my colleagues, my orthopedic physical therapists, if there's a pain and it just doesn't make sense and you're trying things and it's not affecting it, have them come see me just for a screen. You know, we may as well screen and make sure it's not coming from the pelvic floor. So pain is another big thing we can treat. Okay, so what can you do? We're going to go over a whole bunch of stuff, and I want you guys to start doing it today. So one of the things I've already mentioned is deep breathing. Okay, when I say deep breathing, I'm talking the big belly breathing, diaphragmatic breathing, not seeing your chest rise. So what I want you to do later is lie down, relax, put your hands on your belly, and just think about breathing in through your nose and blowing out through your mouth. And you should see your belly rise and fall. Okay, deep diaphragmatic breathing. There's all kinds of videos. If any of you have done any meditation or yoga, you're going to be good at it. You're going to know what to do. It is really important. Again, it helps with that pelvic floor to get it to contract and relax. It works with your diaphragm. Big key is it helps you relax. So that brings me to, most people think with a bunch of these issues, prolapse, incontinence, even with pain, that these muscles should be weak. So we need to strengthen them. Most of my patients, it's not weakness. It's these muscles are so tight. And let's go back to the trampoline. If a muscle is tight, it's not going to do what it's supposed to, like that trampoline, and you're going to have the leakage. You're going to have the prolapse. Something's got to give. So the deep breathing proactively helps a ton. When can you do it? You can do it when you're sitting in your car in traffic. You can do it when you're waiting in the line at the grocery store. You can do it when your children are, all of that. Take some deep breaths. And then I want you to do it on the toilet too. I'm going to demonstrate that in a few minutes, but deep breathe whenever you need to. Okay. Especially when you're feeling yourself get stressed and tense. We're kind of in tune with that tension in our shoulders and our back. Start paying attention to the pelvic floor. I'm pretty sure once you start paying attention, you'll be like, oh yeah, it is tightening up. Let it go. Okay. That is actually one of the most important things. And so when my patients come in and they say, oh yeah, I did notice I'm clenching like this, that's awesome, because everything else will happen too. All right, so deep breathing, very important. Pelvic floor exercise. So these muscles have two main actions. Remember, there are 3 layers and they front to back. So there's lots of muscles down there. The 2 main actions are to stop the flow of urine and to keep you from passing gas, okay? If I was going to have you do a bicep contraction, the action is bend the elbow. Pelvic floor muscles, actions, stop the flow of urine, keep yourself from passing gas. So if you've looked up Kegels and done Kegels before, you probably were taught to squeeze the muscles you would squeeze to stop the flow of urine and hold them as long as you can. Relax and do it again, and then hold it as long as you can. I don't want you to do that, okay? I want you to find these muscles and be able to contract and then be able to relax. That's really important to relax them, okay? Again, later on, lie down, do some deep breathing, and then I want you to try to do a pelvic floor contraction. Actually, I'm gonna have you do it right now. I'm gonna have you guys do it too. What I want you to do is do a couple deep breaths in through your nose, out through your mouth, and do that deep breathing. Just think about deep breathing in through your nose, out through your mouth. Just try to relax in through your nose, out through your mouth. Okay. When I say when, I want you to do a pelvic floor contraction, and I want you to think, stop the flow of urine, keep yourself from passing gas. Squeeze those muscles, but you're not going to hold it. You're going to let go. Okay. All right. Go ahead and squeeze. Stop the flow of urine. Keep yourself from passing gas and let go. And now let's wait 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And squeeze. And then let go. Okay. So I didn't see too much here. A lot of times what I'll see is squeezing the legs together, bending forward, squeezing the butt. Those are not the muscles we're trying to find. We're trying to find the pelvic floor muscles, which again, are deep inside this pelvis. We should not see anything on the outside of your body. All we should see down here, your clitoris and your anus wink at each other, okay? That is why I had this mirror. So again, I want you to practice this and look, lie down, do some deep breathing. When you're lying down, you can also see if you squeeze your legs together, because you're more relaxed, you'll feel if you squeeze your butt. You'll see if you tighten your tummy. None of that. We should see nothing on the outside of your body except for use your mirror, look down there and see clitoris and anus wink. Okay. And when you do this exercise, I want you to do 5, 10, 15 repetitions in a row. You're going to squeeze and you're going to let go. And then you're going to wait 10 seconds and you're going to squeeze and you're going to let go and you're going to wait. Focus on, yes, squeezing, but just as important, letting go. Okay. If you think of an elevator, sometimes that helps. So when you're relaxed, you're on the first floor of the elevator. When you squeeze, stop the flow of urine, keep yourself from passing gas, you're coming up to the top floor, but you're not going to get off. You're going to come right back down. Okay, so sometimes that visualization helps. Find these muscles, do this exercise. It increases the blood flow. It gets these muscles to be more like that trampoline where they can contract and relax and do what they're supposed to do. Okay, so the deep breathing and the pelvic floor exercise you can start doing right away. Anybody have any questions about that? Okay, so the next part, so much fun. All right, so I have some bladder tips for you. And this stuff, absolutely, I want you to start doing. All right, so I mentioned before, and I don't know if you guys caught it, normal we should be urinating every 3 to 4 hours during the day. Well, I have a lot of people that come in and tell me, oh, 10 minutes, every 10 minutes, every hour. And I'm full. I promise you I'm full. Here's the thing. You have urine in your bladder 24/7. You could pee every 5 minutes. Okay. A little bit of a background here. So here is your bladder sitting on top. Here's your pelvic floor. They are connected by a reflex controlled by the brain. 100% they work together. When the bladder fills, it stretches. And then there are receptors on the outside that are stretched. When it's full, they contract. That's when you're like, oh, I have to go pee. Automatically, the fill, the stretch, the contract will happen. Should be every 3 to 4 hours. And then your pelvic floor, you'll relax and empty. Unfortunately, we have control of when we empty. And when you do it too often, every 5 minutes, every hour, what happens to that poor little bladder is it loses that sensitivity. Well, actually, it becomes more sensitive. And when you empty and there's just a little bit of pee in there, the next time there's just a little bit of pee in there, the bladder's like, oh, you emptied me last time, so I'm going to contract. You're not full. You've taught your bladder to do that. Okay. So what do? Well, let's back up. Why would you feel like you have to pee? Well, if you do this bad schedule, you're going to decrease the sensitivity. Well, again, increase the sensitivity of the bladder. And so that it loses that stretch reflex and you feel like you got to pee more. There's a whole list of things that irritate the bladder. I didn't give you that. The main ones are alcohol, caffeine, artificial sweeteners, and carbonated drinks. So a lot of times people do say, oh yeah, first thing in the morning when I have my coffee, I empty my bladder and then I drink my coffee and then I got to go again. Your bladder's not full, it's irritated. Okay, so that caffeine irritates the bladder, it contracts. Same thing with the carbonated drinks, artificial sweeteners. Okay. Alcohol, everybody knows that. You start drinking alcohol and then all of a sudden you got to go pee and then you go and then you have to go again and then you have to go again. It's that the alcohol is irritating to the bladder. The other big thing that is irritating, and it's so counterintuitive, people who are peeing a bunch are leaking. What do? They stop drinking water. I don't want to drink so much water. We had this discussion. I don't want to drink water. I'll have to pee a bunch. Yay. I saw that. She's drinking water. So unfortunately, what happens when the urine is not as diluted, so it's more concentrated with all the yucky stuff in your urine, guess what it does? It irritates the bladder. The bladder contracts. You feel like you got to go. You need to drink that water. Gosh, you need the water for every cell in your body, not just the pelvic floor health and the bladder health. But not drinking enough water is something else that will cause some of these issues. So you want to drink enough water. What's enough water? Lots of different things out there. I drink a gallon at least, and now that it's hot, I have to drink more. I've realized this. So they say, well, it used to be 64 ounces. I don't know any of you that maybe there was a big push years ago, 8 times 8, eight cups of 8 ounces. So 64, that's not really enough. It should be more like 80 ounces for women. That 80 to 100 is usually pretty good, but if you work out or you're active, you need closer to a gallon. So urine should be pretty clear. You just have to figure it out. Of course, you don't want to chug it all at one time. So carrying a bottle of water throughout the day, that should be good. Okay. So let's go back to the 3 to 4 hours. What do? Let's say you got up, emptied your bladder, you're drinking your coffee. You're like, oh gosh, I got to pee again. It's only been 30 minutes. I want you to tell yourself, I'm in control, not my bladder. And guess what I want you to do? Who knows?
Don't go.
Oh, don't go, right? But what do? What is the big thing that I said you're going to do? Yes, deep breathe. So you're going to tell yourself, okay, I know I'm not full. My bladder's just irritated. Take a couple deep breaths in through your nose, out through your mouth. Helps. to relax the bladder. That's going like this, empty me. And then you got to distract yourself. If you're at home or if you're at work, you'll do it and it'll go away. Everybody's different. Sometimes it goes away and then it's not back till the 3-hour mark. Sometimes 5 minutes later, it comes again. Okay. 100% you have to distract yourself, because if you sit there and say, oh my gosh, if I don't go pee, it's never going to go away. I need to go. This lady said not to go. What am I going to? It's not going to go away. You have to distract yourself. Okay. And I promise you it will. Let's say you did it at 5 minutes, 30 minutes. You pushed it off. You started to have the urge at like 30 minutes. You've made it to an hour and a half. And you're like, okay, now I have to go. I still want you to tell yourself you're in charge, not the bladder. Because what will people typically do? Oh gosh, now I really have to go. And they'll run to the bathroom. You're not going to have control when you're in that flight or fight stress. Okay. These muscles need you to be calm. Okay. Completely, again, not what we're used to. Oh gosh, I got to go pee. And so you run. Deep breathe on your way to the bathroom. Okay. I'm going to sit on the toilet. So what do we need to do here? Okay. So you're going to slowly walk to the bathroom. All right. And you're going to go in and sit on the toilet. A big problem people do is when they're at public restrooms, hover over the seat. No. You're not relaxed. So you're causing these, empty your bladder through these not relaxed muscles. You sit, turn your toes in a little bit. What that's going to do is relax your hips. Remember, we talked about a little bit that those hip muscles are right next door to the pelvic floor muscles. So you're going to relax your hips. You're going to lean forward, elbows on your toes. And what are you going to do?
Breathe.
Yes, in through your nose, out through your mouth, and relax. What do we as women especially do? Oh, I'm going to run to the bathroom real quick. I'll be right back. No, I want you to sit. I want you to relax. I want you to deep breathe in through your nose, out through your mouth. It should take at least 10 or 15 or 20 seconds to empty your bladder. Okay. Then if you're having any of the issues I've talked about, prolapse, incontinence, pain, I want you, urgency, I want you to double void. So what that means, you empty. When you feel like you're empty, you're going to sit up. And then instead of getting up and getting out of the bathroom, you're going to do a couple deep breaths and you're going to try again. If more comes out, you didn't completely relax the first time. Okay. So double voiding, that what we want to get to is so that the first time you completely empty. Okay. So if we can get to that, you can relax. We know you're emptying more fully. Okay. And why do we want you to empty more fully and get to that 3 to 4 hours? Because that you're using the muscles too much. Okay. While I'm on my toilet, we're going to talk about bowel movements. All right. So remember we talked about you don't want to push and strain for a bowel movement. Okay. Anybody have a squatty potty? Anyone? No.
We did.
You did?
We got rid of it.
Oh, no. Oh, shoot. All right.
I love the squatty potty.
I know the squatty potty is the best thing in the world. Okay. So think about your dog. Think about other cultures, other countries. What do they do to have a bowel movement? Squat to the floor. Okay. Our hygiene is not that way. So to mimic that, you want to use a stool. All right. So it's the same position with leaning forward, toes in, but with your feet up on the stool, that changes the angle at your hip. It also changes a little muscle, the puborectalis that wraps around your anal opening, and puts it on slack so that you can more easily empty. So what you can do, I used to tell people to use phone books. Nobody has them anymore, but you can find something at home to not practice, but see if you like it before you go buy the squatty potty. Squatty potty has an opening, so you pull it out and in. I just ordered for my husband for Father's Day, a portable travel one that comes in a little case because we're going it's so important. So I'm excited to see it, but I gave him one for Christmas years ago. That's a regular squatty potty. So they're great. I've given him gifts for lots of people, but you don't want to push and strain. So it's one of the best things ever. So try that. And if you have not gone to watch their video, Squatty Potty, they have a YouTube video. It's hilarious, but it's 100% accurate. So, okay. So use a stool, don't push and strain. We talked about sitting on the toilet. We talked about drinking enough water. At night, if you're getting up, so that's up for debate. You really should be able to sleep through the night, okay? So, and not get up and urinate. You make less urine. So if it's 3 to 4 hours during the day, it should be good 6 to 8 hours a night. I have had people come in, they get up 6 or 8 times a night. It just, that's awful. Your body needs to sleep, first of all. I mean, we're talking about the bladder health, but you need to be able to sleep. So most people can get rid of the 3, 5, whatever, and they get down to 1 or 2, and then that takes a little bit longer. What do? The same exact thing you do during the day. And I can tell you, getting on a better schedule during the day will help you at night. So let's say, and probably if you get up 2 or 3 times, you probably get up at the same time. If you look at the clock, it's 2 in the morning and then it's 4 in the morning. You've trained your bladder to do this. So we're going to try to untrain it. And again, think about, we train animals for potty training. We train little people. We can retrain our bladder. Okay, we can do this. So you wake up, you're like, oh my gosh, I got to go pee. This lady said not to do it. What do I do? Have a plan. Okay, take your deep breath. Tell yourself you're in control, not the bladder, and then have something to distract you. Meditate, pray, count sheep, turn on the light, start reading. Distract yourself. Because if you lay there and say, oh my gosh, I have to pee so bad. If I don't go pee, I'm never going to fall back asleep. You won't. So you need to distract yourself. Another thing that helps sometimes is changing position. So if you're on your back, go to your side or the other side or whatever. Some people will wake up and it's morning the next time. Some people, it's an hour later. So you just keep doing it. And then the same thing you do during the day. When you do finally say, okay, I can't, I've pushed it off an hour or 2. I'm going to get up and go to the bathroom. Slowly go to the bathroom. Now, the orthopedic physical therapist side of me, how many people get up in the middle of the night to go pee and then they fall and trip over things and break their hip or, whatever. So there's a whole nother side of this besides needing to sleep for your body, for your health, for your wellness. So many people fall on the way to the bathroom at night. So if you can get there, it'd be great. And then another big complaint is then when they do go all night without getting up and pee, then first thing in the morning, I have to pee so bad. Here's what I suggest, and this will help during the day too. If that really is an issue and you're afraid, I can't wait 3 hours or I can't go all night because I'll pee in my pants, go buy some pads. All right, just go get them. They're not that expensive. Mentally, what's going to keep you from doing what I'm asking might just be that fear that you're going to have an accident, and nobody wants to do that. So go buy some pads. Make sure you use, if you are, and this brings up a good point too, if you are using pads, I would say probably 75% of my patients are using the wrong pads. They're just using menstrual pads. Those are not made to hold urine. Unfortunately, in the stores, they're right by each other. So it's very easy to pick up the wrong pad. So look for the pads, not the ones that are by the tampons. Look for the ones that are by the big Depends. So the undergarments that are in a big package. So you can find that area. They're made to hold urine. So they're going to pull that urine away from your body and keep you drier and keep you from having issues. Lots and lots of my patients who are using the wrong pads and or leaking and they don't even know it. One of their complaints is a history of all kinds of different infections and nobody can figure out what it is. And they go on all these medications, nothing helps. They're leaking urine and that urine just sitting there creeps back up their urethra. It just causes all kinds of problems. So we stop leaking, they don't have any issues anymore. So use the right pads and then a way to see if you, so I want you to use the pads. I brought it up because if that's what you need to get to the 3 to 4 hours or to get through the night, do it. It's worth it. But if you want to see if you're leaking, sometimes you can't see looking at the pad because it pulls that urine away. Put a clean one in one hand and the dirty one in the other hand and weigh it. But amazing that sometimes that opens people's eyes like, oh my gosh. So it's about the same. It's about the same. And one day it's like, oh my gosh, it's really heavy. I didn't know I leaked today. What did you do that day? Was that the day that you went for a run or you went for a walk up and down hills? You did your grocery shopping, you cleaned the house. That'll help you figure out when you're leaking. So love that when people do that.
I have one thing
Yes.
to that. So you can also take Azo that turns your urine orange. So
Oh.
then on the pad, if you're seeing orange, then it's urine.
Perfect. Yeah.
And
That's
that's
great.
just over the counter.
Well, and that brings up another good point because some people just don't want to wear a pad. And then I say, well, then you got to be really investigative of your underwear because we have sweat glands, we have vaginal discharge. There's, you can't tell for sure. You need to smell them too. So, but that's a great idea to do that. Yeah. All right. Very much so. So if you get to that 3 to 4 hours, but you are going to engage in intercourse, it is always a good idea to empty your bladder before and to empty after, just again, to keep any kind of bacteria out of there. That helps quite a bit. We talked a little bit about the core, the abdominal strength. So that's really important too, not especially, but a lot of people have a weakness somewhere in their core, in their abdominals and their hips. So we need to fix that because that works with your pelvic floor. So that's something really important. We talked about doing Kegels correctly. Okay, the pelvic floor, again, I don't want you to squeeze and hold as long as you can. Nobody can do that. So what happens is then you end up not relaxing ever. And again, think of that trampoline. If you're like this, if you're tight, you're not going to be able to give. Okay, if you're walked around with your bicep muscle tight all day and then you went to pick up a gallon of milk, you're not going to be able to. You're going to fail. Either you're going to fail on the way down or fail on the way up. So we need to have those muscles relaxing. So another thing I want you to not do, so we really, that 3 to 4 hours is important, get through the night. Another thing that people do incorrectly, and probably everybody's guilty of this, is jicking. That is just in case urinating. Okay, so what happens? You're gonna leave the house. Oh, I'm gonna go to the bathroom real quick before I leave. You don't have the urge to pee, but you just do it automatically. I used to do it with my kids when I had 4 of them that were out of diapers and we were going to go do something. I may go, everybody go to the bathroom and I don't have to go. I don't care. Go empty your bladder. I don't want to stop. So I did it before I knew any better. I don't know. Maybe we're all raised that way because I feel like everybody does that. They go to the bathroom before they leave the house. You're at the mall and you see a bathroom. Oh, I'm going to go to the bathroom right now just in case. You're at somebody's house and you're leaving. Oh, I'm going to go to the bathroom before I leave. It's just, we're driving and, oh, there's a bathroom, there's a rest stop. Let's stop, even though we don't have to go. Really, really shouldn't do that because again, what does that do? There's just a little bit of urine in that bladder. You empty, the bladder remembers. So stop jigging, okay? Just in case urinating. Stop doing that. And then last but not least on the list of bladder fitness is orgasm. I mentioned a little bit earlier, that's great for your pelvic floor, increases the blood flow, helps with the flexibility. So however you get there, it's very good for your pelvic floor. So that is pretty much everything that I have. Does anybody have any questions?
I'd like to know how much your bladder can hold.
Oh, yeah, that's a good question. So it varies from person to person. A big misconception is you drink 8 ounces of water, it goes directly to your bladder. It doesn't. Every cell in your body needs that water, okay? As you're making your urine, it's pulling waste from your body. So I don't even know the number because I blow it off because it doesn't really matter. Because what people want to do when they want, well, if I drink this much ounces of water, this is how much my bladder can hold. Don't think of it like that. Try to get to that 3 to 4 hours during the day, get through the night. Now, I will say, well, with pregnancy, again, so my pregnant patients, I'm like, 2 to 3, let's try to get there and stay there. Let's try to not get up more than once at night. Different kinds of medications, diuretics, or, so we're going to change it a little bit. So, but still, I don't think I've had anybody that we were under 2 hours at the end. So you really try to get to that 2 hours. even with some of these other circumstances, and no more than once per night. You really should be able to get through the night, but a lot of literature will say 1 time per night, but gosh, if you can get rid of it and sleep through the night, that would be great. So that's a good question, but don't think of it like how much in, how much out. Just drink your water.
Yeah, and I would say like, it depends on the size of person you are.
Absolutely.
A smaller person can hold less. So like a big man can probably hold more, but there's not a point at which everybody's different. The point at which they're like, oh my gosh, my bladder is so incredibly full that they'll just leak. So, you know, I don't think there's like an exact number, like you said. So.
And what we want to do is get you to get your bladder in the best condition that you can get it. So aiming for that 3 hours would be great. And if, you know, and if you can't do that and you get to 2.5, that's great too. We want consistency. That's the other thing I didn't mention. Bowel and bladder absolutely want to be on a very strict schedule. So if you're getting up and pooping every morning before you walk out the door, that you're going to stay that way. Okay. You pee every 3 to 4 hours, you're going to stay that way. Our bowel and bladder love to be on a consistent schedule. So unfortunately, that comes back to bite us when we're peeing every hour or every 2 hours. It's going to keep doing that. And if we're holding it and not pooping every day, and your body gets used to that, it'll just keep holding. So we got to get your bowel and bladder working as best they can. So.
One other thing I wanted to point out that we have here is the Emcella. This is a chair that you sit on. Sorry, well, you kind of see it right there. It's a little chair that you sit on. And
So
it
it's
strengthens
not
the
to
pelvic
replace
floor, Veronica, at all. You need somebody to teach you all of this, all the little muscles and whatnot. But for people who truly have incontinence, based on a weak pelvic floor, it uses MRI technology. You sit on it, it contracts, relax, contracts, relax. The other thing that it does is sometimes people have trouble determining exactly where their pelvic floor is. So you sit on that chair and you're like, oh, those are the muscles that I need to be concentrating on. So if anybody wants to sit on it today, we have it right back there. You're welcome to try it. Oh, and the second thing, I forgot the biggest part here. Speaking of orgasm, so there is a protocol that you can use with the Emcella that's for sexual function that will help improve your orgasm. Yeah, so it really contracts and relaxes the pelvic floor. So Emcella is like this magic machine.
Oh, yeah.
If your incontinence isn't due to a weak pelvic floor, it's not really gonna help you. Might still help your orgasm, but it's designed to strengthen the pelvic floor.
And to help you find your pelvic
Yes,
floor.
exactly.
You know, whether you have weakness or tightness, it's still going to help you find those muscles. And that sometimes is, well, it is one of the most important things we need to do at the beginning of therapy, is find these muscles.
You should, you can have all of your patients sit on it just to help find them before therapy.
Any other questions or anything else?
Any other questions from anybody out there in Zoom land? No, I think that's it. So Veronica, which days are you here?
I am here. I know. I'm here on Tuesday mornings, and then starting in a couple of weeks, Friday afternoons. And of course, if that doesn't work, we can figure something out. As long as we can find some space and time that's agreeable.
Yep. Perfect. And if you just want to see Veronica, you just call and Chloe will get you scheduled with Veronica.
Yay. Well, thank you everyone for being here and listening. This is so important. All of us need to spread the word. Tell all your girlfriends, tell your significant others. They
Your
have
pregnant
a pelvic floor. Yes,
pregnancy. Oh, that's hard on the pelvic floor.
Absolutely. Absolutely. Thank you so much. Thank you.
Thanks for coming.